We see Pseudomonas ears all the time. And so having an in-clinic dose, right, that we can give of a product that has good efficacy against Pseudomonas, I think is really great because like you were talking about those pets that are so painful, that a lot of those dogs are Pseudomonas ears.
Hello, everyone. Welcome to another episode of Vetfolio Voice. This one's sponsored by Merck Animal Health and featuring Dr. Christine McKinney, here to talk with us about otitis externa. So, it's summer, the sun is out, school is over, and the allergic ears are flaring. I love summer, but of course, it comes with its fair share of red and painful ears, including in my own dog. And while otitis is one of the most common conditions we manage in practice, successfully treating otitis and keeping it gone, it rarely seems like a straightforward endeavor. With that in mind, Dr. McKinney and I dove into strategies for giving our treatment plans for otitis the best chance at long-term success. We talked about addressing the underlying cause of otitis beyond the acute infection and building management plans that keep the whole picture in mind. We talked about how factors such as the anatomy of the patient's ears, patient's tolerance for medications, and the owner's lifestyle and ability to medicate can have a huge impact on how well a treatment plan actually works. Dr. McKinney was so helpful and so practical in her insight and recommendations. Let me tell you a little bit about her and we'll go ahead and jump in. Dr. Christine McKinney is a highly experienced veterinary dermatologist and diplomate of the American College of Veterinary Dermatology with a rich background in clinical practice, research, and industry consulting. Currently serving as Senior Professional Services Veterinarian at Merck Animal Health, Dr. McKinney specializes in dermatological solutions for companion animals, including traditional therapies, parasiticides, and innovations within the veterinary dermatology space. A seasoned speaker, consultant, and educator, Dr. McKinney is dedicated to advancing the field of veterinary dermatology through collaborative research, client-focused care, and strategic contributions to the veterinary healthcare community. All right, let's go ahead and jump in.
Are you passionate about animals and love helping people? In the fast-paced world of veterinary medicine, exceptional client communication is just as important as quality pet care. As a customer service representative, you're the heartbeat of the practice, the first and last person clients see. You provide comfort, support, and trust in every interaction. This course is designed just for you. It's interactive and practical, featuring real-world in-clinic video scenarios, engaging knowledge checks, and printable resources to give you the tools, confidence, and strategies to handle any challenge and elevate the client experience. Register today for the Certified Veterinary Client Service Representative course on vetfolio.com.
Dr. McKinney, thank you so much for joining me. I'm really excited to talk about otitis. Otitis can be one of those things that, sometimes we get a slam dunk and, one round and it's a win and we never hear from that ear again, but so many times it's more complicated than that. So I'm excited to dive into it here.
Yeah, otitis is actually one of my favorite things to treat. I don't know if it's just like I like a challenge, right? But I hear so often from practitioners, right, general practitioners, other specialists that it just gives them fits. And it is, I think, like we take for granted, like especially if you have human children, right? Human children, where it's like an ear infection, right? No big deal. They half the time don't even do anything. And in dogs, it's so much more complicated. Like otitis is really an exquisitely complicated problem. And it seems like it shouldn't be. And so it becomes this really big source of frustration for practitioners. So hopefully, right, we can talk about it, make things a little easier for folks.
Absolutely, absolutely. And I love that you present it that way as this very complicated condition that we can end up dealing with. I think that was a big lesson for me when I first graduated and started practicing and was like, but why? But why are we treating this again? This doesn't make sense. And so, yeah, it is complicated. And you kind of learn that very quickly, especially, out in general practice. So when we're talking about managing otitis, what are just, I guess, some good general principles to consider, important points to keep in mind, considering there can really be a wide variety of presentations in these cases?
Yeah, I have kind of over the years, I mean, there's obviously 1,000 roads you could go down, right? We could talk about drug selection. We could talk about, exudate and all of these different little things about it. But for me, I used to talk about this in context of like a three-legged stool, where you had to address all three legs of the disease or the stool would fall over. And those legs were inflammation, which sometimes gets missed. Sometimes these dogs need more systemic control of inflammation than just what the topicals can give us. You need to clear the infection, obviously. And then you've got to deal with the underlying cause. And if you are treating and missing one of those things, there's potential for failure. Now I have adapted, or maybe my system has kind of evolved to look more like an English bulldog, because I think there's a fourth leg that's been added, which is biofilm, which we can talk about. But if he loses one of those legs, he's probably going down, right? So that's just like how I like to think about managing the disease in just like a really high level way, where it's like we've got to address all these four things. Because if we don't, we're potentially setting ourselves up for failure.
And it is a high level view because certainly each aspect there can be really nuanced. But I mean, it's almost like we kind of need that high level view because it takes this very nuanced and complicated condition and it does simplify it a little bit to say, okay, if it's not getting better, which of these am I not treating? And how do I go at it to improve that? And maybe I'll get a little bit better success.
Yeah, and I think it gives a perspective, right? Like you got to take a step back from some of these sometimes because it is so easy to get caught up in the minutia of, well, this drug and these ingredients and this cleaning protocol. And sometimes it's just taking a step back and saying, what are we missing? Like our drugs, the treatments we have, the cleaners we have are all so good, right? There is something out there that will treat all of these infections. So sometimes that question is just what are we missing? And so I like to take that kind of high level view first to look at that patient as a whole, and then you can start diving into what are those minutiae or what are those nuances in each of those kind of groups.
Absolutely, absolutely. And along those lines, talking about the drugs that we have that I agree with you are so good. Oh my gosh, just the options we have now compared to 10 years ago, it's a night and day difference. And also keeping in mind that inflammation aspect, I've really appreciated the utility of leave-in products in general practice. It helps so much with compliance. And then that inflammation piece, if we have really painful ears, we don't have owners trying to fight to get medications into the ears, which I guess also speaks to compliance, but not so much from the standpoint of the owner just doesn't want to do it. Just they can't touch the dog's ears, they can't get the medications in. But recently we've heard kind of, different things about the medications that we have available. I would love your perspective on some of those as a dermatologist.
Yeah, so I think dermatologists, to some degree, we're kind of haters sometimes about these things, right? But I think that to your point, there's great utility for these in-dose, in-clinic or leave-in options. And one of those absolutely is like aversion to treatment. I would see dogs as, second, third, fourth line cases that were just miserable, right? And just were so painful in their ears and were so averse to letting people do anything. And it doesn't have to be that way. Like I think that managing their pain, managing their inflammation, like straight out of the gate, if you've got an allergic dog, they're probably going to get otitis again at some point, right? So let's just like set us all up for success and minimize their discomfort. So I love that fact about these products. Any of these ones that are dosed in clinic, that are leave-in, it gives kind of a treatment holiday for pets that need it, and owners that need it, frankly. And I mean, I think the compliance issue speaks for itself. My experience as a dermatologist and my perspective is that it's all about patient selection. Being successful using these products is looking at really like how much exudate is there, what's happening on cytology. Those are really kind of the two big things, the factors or kind of criteria that I would look at to determine if I think a pet is going to respond well to one of these. I think also thinking about what the ingredients are, right? What are the actives in these products? So if you have an ear that is just like what we would call a swamp ear.
Sure.
Right? So
I think we can all picture that.
Yeah, right. I trained in Louisiana, and so the swamp ear
I
was
love
like a thing. So if you have a swamp ear, right? And you've got that really significant biofilm. And you know what it looks like, right? It's like slime. I mean, this is
Sure.
not something we can always say, oh yeah, you've got, 90% biofilm or whatever, a strong biofilm producer. But, that ear is probably not one that a leave-in is the best choice for because you have to be cleaning frequently. You have to be disrupting that biofilm physically. You can't expect this ointment that we put in there to penetrate all of that. And so if you have a really super highly exudative ear, or if you do cytology and there is just like wild numbers of neutrophils, we're probably better off using a daily treatment if we can get away with it. So if the dog is compliant. But if you have, moderate exudate, if it's, the tympanic membrane should be intact, ideally, and you've got, a population of whatever you've got there that you think will be susceptible to those ingredients, I think it's a great choice. Sometimes that decision is made for us because the patient won't let the owner do anything. Sometimes it's made for us because that Labrador is going to run and jump in the pool regardless of what you tell him to do and, wash all that out. So I think that they serve a great purpose. I think that just choosing the right patient will get you so much more success on the back end.
Sure. I think that's such good advice. And yes, I can picture the two different types of ears you're talking about and how each of those patients would present. I'm curious from an antimicrobial stewardship perspective, thinking of say this swamp ear, because oftentimes, like you said, tons of neutrophils and these are really painful. If we had one of those and the owner isn't able to do a lot of cleaning at home because we have a really painful dog. Do you think there's utility there in using these products to reduce the inflammation so we can get to the cleaning point? Or are we really kind of playing with fire with antimicrobial stewardship there and maybe we should think about oral steroids instead or both?
I think for me, the choice would be both. Like that dog that's really painful or has a really edematous ear, they're probably getting systemic steroids from me most of the time. It can cut back that exudate pretty tremendously.
Sure.
But from an antimicrobial stewardship standpoint, which to be, totally fair, is a really complicated, again, like just like otitis, antimicrobial stewardship can be really nuanced and complicated. But I think there's a couple of ways we can think about it. For one, if this is a patient, so if this is a treatment, for example, like a gentamicin-based treatment, and the pet's had gentamicin in the past, I don't think that we are creating, we're not exposing the patient to anything new, like new classes of antibiotics. I think that if it's a fluorophenocal-based, and they've had a lot of fluorophenocal-based treatments in the past, right, we're not necessarily introducing a different antibiotic into that pet's like previous exposures. Very simplistic kind of way to think about it. But at the end of the day, yes, we want to practice good antimicrobial stewardship. It's something I'm super passionate about, but we also have to treat the patient that's in front of us. And I don't think it's fair to let a pet walk around with, Pseudomonas ulcerating his ear canal any longer than we have to, right? And so I am totally on board with saying we're going to give you some prednisone or some dexamethasone systemically. And yeah, we're going to dose you with one of these things to hopefully, maybe it's not the ultimate answer, but maybe it will knock it back and push that pet to a better place where they are able to be medicated, maybe with an ideal treatment, right? So I think absolutely we can use these as a middle step.
Absolutely. I think you're doing such a good job of illustrating your initial point of case selection with these and really, like you said, looking at the patient in front of you, understanding, how that client is going to be able to manage the pet at home and making decisions on a patient by patient basis. And also to one of your original points, how nuanced and complicated it can really be when you get down into the minutia and not to minimize it with the minutia, it's important, but there's a lot there. And so I love that answer because I think it just illustrates the complicated nature and the nuanced nature of otitis and patient selection and how individualistic these plans really need to be.
Yeah, I used to talk, and this is the way that I talk about allergies and allergy management. And obviously, otitis and allergies are really heavily linked, but I used to talk to owners about this in a way of it's a puzzle, right? Like your pet is its own puzzle, and we've got to figure out what pieces make up their puzzle. And I think that applies to allergy management, but definitely for otitis, right? Maybe this is a pet that a fluoroquinolone is a really good option for, but we've got to find the right combination of like vehicle and cleaning, and the length of treatment and that's frustrating, right? As practitioners, because people are busy and you don't have an hour to sit there and comb through these cases sometimes. And that's one of the luxuries as a dermatologist, as a specialist, that we tend to have longer appointments. We have an hour to sit there and talk through all the options. And so this is tough. Like it is a tough thing as especially general practitioner or somebody in the ER or somebody on an urgent care service to say, okay, you've got 15 minutes, like we can't really figure out what all those pieces are right now.
It's a good point because you're absolutely right. That can be a really big challenge when we do have the shorter appointment times. But I think we get there in a different way. Mainly what I always think about with owners in these cases where, it takes a little bit to really convince them that this is a long-term issue that we're going to have to revisit multiple times. So I think of it as sort of like planting the seed as we go.
Mhm.
So, hey, this is your first ear infection, but your dog is awfully young and, maybe a breed that's predisposed or something. This is probably something we're going to do again. The management might become more involved. These discussions might become more in depth and just that gradual treatment approach. So yeah, it sounds wonderful to be able to sit there and have the whole conversation all at once, but really a lot of owners aren't receptive to that at first. So it's not always the worst thing in the world, at least in my experience, of having to kind of do this over time and plant those seeds. And then when we get to the point where like I always the food trials are the big one for me. Like, remember how we talked about that food trial a few months ago and you said absolutely not? Well, here we are. Let's talk about it again.
Yeah, and I think that that is the way to go because you don't have to hit everything super hard right at the beginning. Like, yeah, sometimes you just have to treat what's in front of you, right? We're going to deal
Yeah.
with this otitis today. But planting that seed, I think, goes a really long way with people. My clients, by the time they got to my office, they had gone through all of that and they had processed the fact that their dog is going to see a dermatologist, which sounds like a really silly thing to do, right? Like, I have to take my dog to their dermatologist today. But by the time they got to me, they were ready for that. And I think that what I would hear from them is when their general practitioner had set them up along the way, that, hey, yeah, like we're getting to this place. Man, they were such wonderful clients about it because they were ready, right? And they knew.
Ah, I love that. The seed planting is working.
Seed planting is absolutely working. I'm
Ah, that's just
fully on board.
makes my day. I love to hear that. We've talked a lot about case selection and choosing the right patient for these different products, but there's also something to be said for client selection in these cases.
Absolutely. One of the things we hear most from, those in the trenches is that compliance is the biggest hurdle when managing otitis. And I can sit here all day and say, oh, use an aminoglycoside or use a fluorophenocal or whatever. But if you can't get it in the patient, the best treatment is the one that we can do, right? And look, I am that client to some degree. The cobbler's child has no shoes. Like my dog, were he
You
to
and me
have
both.
otitis, probably is not going to get his 7 day, every single day treatment, if I'm being totally candid. So if we're selecting a patient that we have in front of us that we say, yeah, I think you're a good candidate, right? Like, I don't feel strongly either way that you need a daily treatment or you need a leave-in. Sure, if compliance is that issue and that client is going to say, hey, doc, it is just not going to happen. Again, the best treatment is the one that we can do. And so if the question is this or nothing, right? I think the answer is always use the leave-ins. Now, if the client knows, if you're saying, hey, I don't think this is like quite the best option, and they're like, I will not, cannot, for whatever reason, get a daily treatment in my dog, something is better than nothing. But sometimes it's just a question of convenience. If you've got an ear that you think is perfectly suitable for an in-clinic treatment, or especially I think our friends in urgent cares, in ERs, where maybe these are not the clients that are going to their vet on a regular basis, and you just want to give them the best shot of getting a successful treatment, I think that's absolutely an important piece for people. It doesn't work if it doesn't go in the ear.
Sure, sure, absolutely. It reminds me of like when we're talking about nutrition and it's like the best diet for that animal is the one that they'll eat.
Yeah, absolutely. Absolutely. And sometimes it's not a question of, look, we're all busy people, we all have
Sure.
priorities, but sometimes it's things that clients don't even necessarily share with you. I had a client, and it's always stuck out to me. It was pretty early in my career, and my technician would always go in and show them how to apply the drops. And we had, being a dermatologist, we're mixing things up, don't tell. And it was in a larger, softer bottle. And she said, "Oh, I'm so relieved to see that this is in a bigger bottle because I have really bad arthritis in my hands and I can't squeeze the little tubes." And that's not something that she had readily shared with us until after we had prescribed that treatment. And so there are, I think, sometimes compliance issues that are a little invisible beyond just the owner's not going to do it.
I totally agree. I think it's so important to keep those things in mind that very rarely when we get non-compliance from a pet owner is it I just don't care and I just
Mhm.
don't want to do what you told me to do. Almost always there is some underlying reason there that is that probably a lot of us can relate to.
Yeah, that is that is so true. And we so inherently, right, because we've been doing it for years, we know how to restrain a dog, right? We know all the
Yeah.
tricks. And coaching clients sometimes is necessary, but if we have a in-clinic application product that just takes all of that, off the table, and again, it's an appropriate patient, that is like, I think that that is such a relief both for the client, but also as us with veterinarians, that our patients are getting the right treatment, they're getting the dose, right? They're getting the full treatment course, and that we controlled it, right?
I couldn't agree more. I'm 100% on the same page. Well, we're talking about these in-clinic
Mhm.
applications, leave-in products, and how to manage dogs who are really painful and maybe tougher to medicate, at least in the initial stages of diagnosis. And I think a lot of the products, when we talk about in-clinic application that we've used to this point, are those florfenicol
Mhm.
based. But I understand that there's another option that we're going to have available to us. Can you tell us about that?
There is, and I'm really excited about it. Again, like dermatologists can kind of be haters sometimes about leave-ins, and this one I'm very excited about.
Yay.
So it is called Momentum Single, and it is a combination of ingredients we all know and love, but this is the first time they're all together in one product. And so gentamicin, which is the antibiotic, same antibiotic that's in Momentum, again, that we all know and love, posaconazole, which is an antifungal that is in Posotex, hence the name. And then mometasone, which is the anti-inflammatory, the steroid that's in both Momentum and Posotex. It is a single in-clinic dose, so it is a unique packaging too, where basically it's a single dose bottle. So it's got 20 doses in it. You shake it up, and that comes with 20 syringes, and you just pull up to the pre-marked line. It's zero point 0.8 mils of volume, and that's what you get per ear, regardless of the size of the dog. So it is the one of the great things about it, and one of the things that I love and I think really sets it apart is not just the ingredient mix, but we are the only in-clinic treatment that is labeled for treatment of Pseudomonas. So that is a differentiator. Phenocols is a class. For us, it's fluorophenocal and chloramphenicol if we're talking about systemics. Those are not good choices for gram-negative bacteria, specifically Pseudomonas. And we see Pseudomonas ears all the time. And so having an in-clinic dose, right, that we can give of a product that has good efficacy against Pseudomonas, I think is really great because like you were talking about those pets that are so painful, that a lot of those dogs are Pseudomonas ears.
Oh, 100%. And I'm curious when we're talking about Pseudomonas and leave-in because these dogs often are so painful that cleaning can be challenging.
Mhm.
Biofilm and Pseudomonas and this product, any information there?
Yeah, so we have some data that show that even dogs so when they do these clinical trials and they have their 300 dogs and, that all get treated. And when you are the clinician running the trial, there's you do these little scores, right? So you measure exudate and erythema of the ear canal and erosion and like it totals up to a score. And that's how we determine whether or not the product's working. But we've had some data that said that dogs, even with severe exudate, could still respond to the product. And I think that that is a consequence of probably two things. I think the mometasone there is absolutely helping. That is a really good, strong steroid. But the gentamicin, there was a paper published pretty recently in veterinary dermatology that showed that gentamicin can have direct antibiofilm properties. And so I can't say for sure, right? Like I don't know that that is exactly what's making these dogs better, respond better.
That is really exciting to think of, the swamp ears. I always think of, yeah, like the green
Yeah.
snot that's coming out,
Yes.
and you're like, oh, you poor creature, you.
We had one that one of my technicians called a chocolate syrup ear.
Oh no. Oh, that's terrible. Was it like all, was it the trifecta?
It
Like
was
the
it was no,
yeast
it was a
cocci rods?
pseudomonas, but it
No
was just
kidding.
brown and
Oh.
it was like brown water. It really looked like mud, like muddy swamp water. Oh, the smell. Anyways.
Oh my goodness.
Yes.
Yeah, those are the days that I'm very thankful that I have almost no sense of smell. And, I have like technicians gagging next to me and I'm
Mhm.
like, does it smell? Is it stinky? I'm so thankful. Um, but no, that is exciting because of course that makes sense that we have to get this cleaning done in order to break down the biofilm. But of course it's going to come right back as long as the bacteria is there. So to think of a product that potentially can have efficacy, not only being labeled against the bacteria itself, but have some efficacy against that biofilm is pretty exciting.
Yeah, it's something that I would love to investigate more. I hope I
Yeah.
get the opportunity to do it because biofilm is just like, that could be a whole
Right.
podcast in and of itself. But yeah, it's really problematic.
It
It,
is. It is. And like you said with the mometasone, that took me a minute to wrap my head around of how effective steroids were at helping to break
Mhm.
some of that down. So I know you mentioned that earlier of doing the oral steroids to reduce the inflammation and then also reduce that exudate a whole
Yeah.
bunch. So yeah, I mean it sounds like a really effective combination. Can we talk about the posaconazole too? From what the little that I know about it, I understand it's pretty potent antifungal. So is there anything we should keep in mind with that in particular? Of course we're familiar with Posatex, but in this formulation specifically?
Yeah, so there's again like it's a few things and there's a few kind of competing things and I think that's going to have deal with what kind of patients you're seeing and maybe what part of the country you're from. So posaconazole is a very potent antifungal. So in vitro, it's something like 40 to 100 times more potent than terbinafine. And terbinafine is what's in the fluorophenocal-based treatments as the antifungal. So very, very potent. And so one way to think about posaconazole is if you have those pets that just have those horribly persistent yeasty ears, like you just can't quite get rid of it and can't quite knock it out. Or if you have that pet that has like a true yeast hypersensitivity. I had a few cases. One was, of course, it was a poodle and just some of the most painful ears I've ever seen. And it was just because of a true yeast hypersensitivity. And it was so hard to control. But that poor pet was on, I mean, I think I had that dog on multiple pain control measures, but that was like a true yeast hypersensitivity. And so posaconazole for those dogs can be a really wonderful tool because of the high potency, you're going to get a quick kill, and you're going to get a reliable kill of the yeast that's so problematic. The reason that I had mentioned earlier about like maybe geographic situations is if you're in an area that has grass awns or that you're maybe dealing with like an aspergillus ear sometimes and from my understanding I don't live in an area that has grass awns but if you're in like Northern California my friends in that area sometimes they want to reserve posaconazole for treating those cases not for the yeast but for the aspergillus that comes
Oh,
along with the grass on. I know this was something that as the conversations about posaconazole have kind of evolved was like, that is something that I've never had to deal with as a practitioner. And so they're like, well, we really like to reserve posaconazole for in case there's an aspergillus. And so again, I think if you're in that area, that is a totally reasonable approach to take, right? Like if you
yeah.
want to like treat it as I don't really love the term big gun, but if that is something you want to reserve for tougher cases or more severe cases, I think that that is totally reasonable. But I do think that there's absolutely a place for it in some of these everyday yeast otitis cases that are just so horrible.
And just to clarify, they're saying is Aspergillus otitis?
Yeah, so these
What?
grasslands will bring aspergillus in.
Oh my God. Like otitis is complicated enough without adding like aspergillus to it. Goodness gracious. That is not something I've ever encountered either.
I don't know that I have either. I've had a few weird like actinomyces ears. Like I've had a few
Okay.
there, little odd things, but I don't know that I've ever had an aspergillus ear. But apparently
Wow.
it's a thing.
That is just not fair. I'm
This
so
is not
sorry
something I
to
want to
all
be.
of our
I know.
colleagues in California. My
Oh, I
gosh.
know.
But that's good to keep in mind because not something I ever would have thought of. But also, I think it's like so much of what we've been talking about this whole time of it's patient selection and it's a balance because certainly a potent antifungal, but there's something to be said for, this ear is really painful. We have to get rid of this yeast now. We don't have time to mess around. And, we put it in there and of course now they've seen this drug, but they're dead and gone. And so we've accomplished what we set out to do.
Yeah, and that is, I think, something that unique when we're talking about antimicrobial stewardship, whether it's antifungals or antibiotics, something really unique to otitis management compared to managing infections in other parts of the body, because we are talking about topicals, versus systemic treatments. And what that means is that we are getting, regardless of what topical it is, we're getting a really, really high concentration, like exponentially higher. We're talking 10 to 100 times probably higher concentration through a topical than we ever could get with systemic treatment safely.
Right.
And so that is why we can have efficacy with treatments that, if I would see an enrofloxacin resistant on a culture, topical enrofloxacin at the right concentration might still work. And it often did because, again, we can get such a high concentration on it. And so, when in the context of antimicrobial stewardship, if we can kill that bacteria or that yeast really quickly and reliably, I don't always like the, again, this is an oversimplification to think about just coming in and blasting it, right? Like it's more complicated than that. But if we can kill off as much of the population with that super high concentration super quickly, there is less likely that we're going to leave resistant strains, right, around.
Sure.
The high concentration can often overwhelm resistant mechanisms or what do we call it, like efflux pumps, that sort of thing that these bacteria have evolved. And so if you just throw enough on there, a lot of times you can overcome that. And so for me, thinking about, that's just kind of one way to think about antimicrobial stewardship, that having a quick kill, having a reliable kill right at the jump potentially is reducing the risk of subtherapeutic dosing and reducing the risk of resistance development.
Absolutely. And I think that also goes back to patient selection. Like you mentioned, efflux pumps. And so looking at what you have in front of you and, are we looking at a Pseudomonas? I love all of the information and just the emphasis on being aware of the nuance that when it comes to treating otitis. What about now we finally get this infection under control, whether it's Malassezia or Pseudomonas or something else, and we want to keep it from coming back. It's, and I always tell owners, like, this isn't going to be perfect. We're going to be back here
Mhm.
again, but we're going to try to minimize that as much as possible. What should we think about in terms of prevention?
Yeah, I think there's a lot of different ways to approach it. One is absolutely underlying cause, right? Like first and foremost, why is this dog getting otitis to begin with? I always say that otitis is always a disease state. Otitis is always abnormal. Like if you really want to watch me kind of twitch, is to come to me and say, well, he just gets ear infections because he's a Labrador.
Right.
And I have a Labrador who does not get ear
Same.
infections.
Oh, mine does.
All right, well, you can call me after.
There we go. I will not attribute it to him being a Labrador. I will fully attribute it to underlying allergies.
And it's just like, well, yeah, because Labradors are prone to atopic dermatitis, right?
Right.
But the first thing is underlying cause. If you see, yeah, a 2-year-old lab come in every summer with his yeast otitis, right? That is a pretty easy underlying cause. And maybe that pet doesn't need that treatment year round, right? Like maybe it's
Right.
like, hey, I know you've been coming in here every July for the past 2 years. we're going to start working on this in June. And for that dog, maybe it looks like you start a cleaner, maybe once or twice a week. I think once for most dogs with normal-ish ears, right, is more than adequate. Sometimes twice a week if they're swimming or something like that. And I love using just topical steroids as a preventative. You
Right,
can
like a hydrocortisone or something.
yeah, so there's a hydrocortisone, 1% hydrocortisone options. There's fluocinolone, just Synodic, that's a little more potent, that's got DMSO in it. So that's one that I might choose for, something, an ear that maybe has some more chronic change.
Sure,
The
sure.
DMSO is going to help drive that fluocinolone deeper into the tissue.
Okay.
But a 1% hydrocortisone product 2 or 3 days a week can be super helpful to
Absolutely.
stop that inflammation before it starts. It also will help. A lot of these products have astringent properties where it'll help dry out the ear too, right? So
Ah,
if there is
that
going
makes
to be
sense.
natural moisture in there, because inflammation makes things hot, it makes things moist, that can help dry that out. And so that's usually like for that Labrador, I would say let's start a month ahead when we think it's going to come and let's get you on a protocol. And these topical steroids are really mild potency as a general rule compared to something like mometasone. These are much more mild on the potency chart so that you could use them every day. There's certainly going to be a dog, like if you've got a wildly uncontrolled diabetic or cushingoid, maybe not. But for the average dog, they're not going to get a lot of systemic absorption, and these are really, really safe to use very frequently. So that's like how I would approach kind of that dog, right? If you've got an obvious allergic dog, yeah, we're talking about food trials, we're talking about atopic dermatitis. But if you've got like a 7-year-old golden retriever that walks in with the otitis for the first time ever, got wear alopecia around its neck, it's got a rat tail, right? Its coat
Sure.
looks all sad. That's going to be a different discussion. And so when you're talking about how do we prevent otitis, it's really that question of why is the dog getting it in the first place?
Absolutely. Yeah, and I love all of that. That very much has mirrored my experience. And I'm glad to hear about the lack of systemic absorption with some of these topical steroids because, like I mentioned earlier, really wrapping my head around how effective oral steroids are at breaking
Mhm.
down some of the biofilm and things like that. It really brought to light how big of a role inflammation plays. And if we can keep that inflammation under control, the ear can do so much on its
Mhm.
own. So yes, I love those products and focusing on prevention in that way. Again, I think we're back at patient selection again.
Yeah.
Are we looking at the 2-year-old Labrador? Are we looking
Mhm.
at this older golden retriever who might have some other things going on? And yeah, paying attention to help drive us down the right road to identifying the underlying cause and making sure that we can get a really good handle on that.
Yeah, and in vet school, they used to tell us like, hey, look, some animal's gonna walk in and you're gonna find all these other things wrong with it. But if you don't address the reason that the pet is there in the first place, right? Like the client's going to be upset. And so,
Right.
yes, for that golden retriever, you've got to treat the infection. And maybe that is that visit. Like you were talking about planting that seed. Maybe that is that visit. And maybe that day you say, hey, we're going to treat this infection. And then I want you guys to come back in a week because we're going to recheck a cytology, which you should all do all the time. And we're going to draw some blood to check thyroid, right? Like maybe that's how that goes. Maybe that's how that conversation goes. But yeah, patient selection, taking that higher level view of why are they here in the first place? And sometimes this is an easier thing to manage, right? Like if you've got a basset hound, and God forbid you have an allergic basset hound,
Oh
right?
gosh.
That's just Sisyphus pushing the rock up the hill, right? Like
Yeast factory.
this is gonna be problem and it's gonna be tougher. But for that, some of these, right, are curable. Sometimes if you've got that hypothyroid golden and you manage a thyroid, he's probably not gonna get otitis again.
Sure. It reminds me of this one case that I will never forget. He was kind of like a wolfhound mix type of dog, and he started getting otitis, and it was recurrent. It seemed like no matter what we did, and we did a diet trial, and it was purely food allergy. Like we did nothing else other than change the diet. The otitis went away. And it's like when you take the medication, you feel better, so you stop taking the medication. And so the owner was
Yeah.
like, "Are you sure it's the food?" I was like, I'm pretty sure we can
Mhm.
challenge if you want to." He said, "No, no, no, we'll do it." But then the dog accidentally got into some food he wasn't supposed to. Raging otitis came right back, and the owner was a believer. And I felt like that case was so unique because it was just a pure food allergy. And as long as he stayed on on the diet, his ears were pretty perfect. And then, but one little bit of something else and just raging otitis.
It's the best, right? Like when
Yes.
you find that purely food allergic dog.
Yes.
And it's funny because people of all the things, like you mentioned, that diet trial, getting them on board for the diet trial is just such like they just don't want to do it.
Right.
And I get it,
Oh,
right? It's
yeah.
inconvenient. Sometimes it's more expensive. But I used to tell people all the time, like, you want the food allergic dog is the one you want.
Yes.
That's way easier and way less expensive on the whole. Like you want your dog to have a food allergy if your dog's going to be an allergic dog.
Right, right. As opposed to, atopic
Mhm.
dermatitis where, it's progressive and lifelong and we're gonna have to revisit this several times. Like, can we just eliminate whatever ingredient and away we go?
Yeah, and I think it's important too that when we're talking to owners about otitis, it's like, look, like you don't want to be in here every 3 months. It's gonna cost you more. Your pet's gonna be
Mhm.
miserable. You're gonna be miserable too, right? So like this is the second or third time you've been here, right? Like let's hit it hard because potentially this is something we can control and we should be able to control it. There are a few practitioners and dermatologists, and I would say that I probably fall into this camp. Tim Nettle, who is a wonderful dermatologist who wrote, there was an article published in JAVMA, I believe maybe a year or two ago, that's a really great update on chronic otitis and recurrent otitis. And he makes the very clear point that TICAs are avoidable and that surgery is avoidable. And, I like how hard he comes down on that line because I was kind of like, yeah, I think that like I'm that person too. There's going
Sure.
to be cases, right? There's going to be the Cocker Spaniel where there's clearly some genetic situation happening, or that Frenchie that has just like canal atresia because of its breed. But I think so many of these cases, these Labradors, these Goldens that end up needing TICAs when they're 12, 13, that's all really avoidable. And I don't think it's wrong to present that to your clients as a
Sure.
potential end game, right? And a lot of times people are like, they just have no idea because this doesn't happen in humans. Unless you've had a dog that's had otitis, like they have no idea that that's where they could potentially land. And so sometimes I think showing them, like, hey, the end of the road could look like this, I think can really help sometimes get them on board.
That's a good point. I never really thought about that because we see it so frequently,
Mhm.
not to the level of needing to get a Tika, but knowing that that's a possibility if we don't get this under control, that it's like so many things that it seems very intuitive for us, seems very obvious, but when you talk to an owner about we're going to remove the entire ear canal, they're like, you're going to do what? And it's, completely mind blowing, such a foreign concept. So yeah, there might be something to it if we are getting a lot of resistance, frustration, non-compliance to say, hey, I know that this could be the end point for your dog if we don't get this under control, but you don't know that this could be the end point. And so let's talk about that for a minute.
Yeah, I definitely think that that resonates with owners, especially if that dog, I would see cases mostly on referral. Sometimes we would have self-referrals, but mostly on referral. And these cases are often the worst of the worst, right? They are the cases that have failed multiple treatments or have been going on for a year, or that ear canal is just so stenotic. And sometimes even when they would end up in my office, the owners would still be kind of reluctant, like, oh, I don't know that I want to put them on cyclosporin, or I don't know that I want to do
Hmm.
this ear flush. And it's not a coming from a place of judgment. It's just, hey, look, this is kind of the roads that we might go down. And the
Right.
path may fork towards we get lucky and more conservative things work. The path may fork towards yeah, cyclosporin works and we flush your dog's ear and we're still going to have to do some work, right? It's not a magic cure, but it's going to be better and the path forks to surgery. That is it is aggressive and
Hmm.
it does have complications and it is expensive and it's putting a lot, we get the lot of like, oh, my dog's older, I don't want to put them through that. But chronic otitis is really painful.
Yeah. It's like so many things where, you do it and then you just have a different dog afterwards.
Yeah. Yeah. I think that too is a specialty as dermatologists, we are recognizing more and more how painful this is. I
Yeah.
mentioned that dog that had that horrible yeast hypersensitivity and I had him on multiple pain control. The thing that ended up working for this dog was amantadine and
Oh
gabapentin
man.
because it had so much wind-up pain
Oh.
from years of just chronic otitis. Now he was on cyclosporin and some intermittent steroids too, but that was never enough. And it ended up that the wind-up pain was what was just so problematic for this dog. And I think that there's so many dogs out there that we just don't even recognize it.
Mm-hmm.
It's probably walking around with like a chronic headache, right? Like,
Oh,
like
poor
forever,
pup.
for years.
Yeah. Oh my
It's
goodness.
had a headache for years. So I think pain management too for these dogs, when we start getting into that chronicity place where, hopefully we're not at Antica Town yet, but we're in a chronic change area. I think adding on pain management too, I think is something that we often neglect that can be really important for these guys.
Absolutely. Oh, that sounds like my own personal nightmare, walking around with a headache all the time. Poor dog.
I actually got an ear infection, which in humans we get middle ear infections,
Right.
right? That's what we get. When I was in vet school, and I never had an ear infection. God, vet school does crazy things
It
to
does.
you. And I remember standing in the hardware store, and it was just like out of nowhere. I couldn't hear anything. It was so painful. You feel like you're underwater. And I was like, is this what dogs that walk
Oh.
around with like chronic otitis or chronic otitis media, right? That's something that a lot of dogs it's subclinical sometimes. And it was such like a lightning bolt moment for me of like, dang, this is really like this is the worst.
And from there, your future as a dermatologist was sealed.
Right.
But to your point, I have two daughters, they swim, and one of them, they swim so much during the
Mhm.
summer because they're at camp and they're in lessons and all this stuff, and got swimmer's ear, which I've always heard it as swimmer's ear. Turns out it's otitis externa. That was news to me. Shouldn't have been, but it was. And she was so painful. It was, yeah, it really demonstrated, like you said, how painful these can be. So I'm glad that we brought it back around to talking about making sure that we're managing that part of it too.
Yeah, I think that we're starting to recognize, and I think people are really getting on board. And kind of to that place, I would say, in my experience, the most useful tools for managing pain, like otitis pain, steroids, right? Like nobody likes them. They give them side effects. I get it. But even just like a good high anti-inflammatory dose, and I know dermatologists that will go up higher, but I would usually hover around a mg per kg a day for 7 to 10 days and then taper them off. And that usually goes really, really far. I did find too that gabapentin could be helpful. I did have that one dog that got the special protocol. If you are comfortable using acetaminophen, that's also something that I've seen like from our European and Australian colleagues that use
Okay.
that more. I do tend to avoid non-steroidals
Right.
mostly because, right, a lot of these dogs are going to need steroids at some point. But I also have just not found, like, I have not been impressed with how they work with the response to dogs with otitis with non-steroidals. And maybe that's because these dogs, maybe their infection isn't well controlled at the time. Like it's hard to know, but I just haven't found non-steroidals to be particularly useful.
I would agree that obviously you've seen many more of these cases than I have, but yeah, I feel like steroids all the way, these guys.
Yeah, it's great. It reduces the edema, it helps the pain, and it shuts down all that neutrophilic exudate.
Right.
It
We
goes
just
so
win on
far.
all fronts.
I know. I know
Uh,
they're peeing on the carpet, but
but yeah, okay, so we lose on some, but we win on so many others.
I know. I think it's absolutely worth it.
Absolutely. Well, Dr. McKinney, I have thoroughly enjoyed this conversation. Otitis, kind of like we've been talking about how complicated it is. This is something, we've talked about multiple times on the podcast from different aspects, and I always learn so much every time we have a conversation about it. So thank you for joining me and for all of the great information.
Yeah, you're welcome. Like I said, I love treating otitis. I love talking about it. I learn new things from my colleagues all the time, right? We're always like alchemists. We're here go whipping up new things all the time. But no, I think that there's so much out there, and as students in vet school, we don't get we even if you've got a wonderful dermatology service, you just are not going to in that 2 weeks, or if you're lucky you have 4 weeks, be able to see all of the iterations that are going to come at you the day you
Yes.
graduate. And so I think there's so much great information out there. I think there's so many people that have good ideas. I think there's so much to learn. So I'm happy to add to that conversation.
Thank you again. It's been really great to talk to you this morning. Thank you so much to everyone who tuned into this episode. Otitis externa can really be a tough condition to manage, so hopefully you were able to take away some helpful points out of this discussion. I want to say a big thank you to Merck Animal Health for making this episode possible, and of course, thank you so much, Dr. McKinney, for joining me. It was really wonderful to talk to you. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast. It'll help other veterinary professionals like you find this and other great content we try to put out there. For more episodes, click on the Education tab on the Vetfolio website or find us wherever you get your podcasts. As always, we'd love to hear your input on this episode as well as ideas for what you'd like to hear in the future, so feel free. You can reach out to me at dvm@vetfolio.com. We can also connect on Facebook at Dr. Cassie DVM, or you can find me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day. Mometamax Single, gentamicin, posaconazole, and mometazone furoate otic suspension. Important safety information. Mometamax Single is for otic use in dogs only. Do not use in cats. Mometamax Single should be administered by veterinary personnel. Do not use in dogs with known tympanic membrane perforation. The integrity of the tympanic membrane should be confirmed before administering the product. Reevaluate the dog if hearing loss or signs of vestibular dysfunction are observed during treatment. Do not use in dogs with known or suspected hypersensitivity to gentamicin, posaconazole, or mometazone furoate. Avoid contact with eyes. For complete instructions and safety information, refer to the product label.